Properties of Cannabis Derivatives in Alzheimer's Disease. A book written by Pharmacology University. Narrated by Sandra Loaiza. Introduction. Alzheimer's disease is a degenerative disease of the central nervous system that causes cell death. It is known to be the most frequent cause of progressive dementia in the elderly. This type of disorder is often mistaken for old age or common forgetfulness, statistically accounting for almost 2/3 of all dementia diagnoses. As reported in the World Alzheimer's Report, by 2018 the number of people with this disease amounted to 50 million in the world. Dementia is a term that encompasses a group of neurological disorders characterized by the appearance of social symptoms that interfere with the proper development of daily life. In other words, dementia is not a specific disease, but a group of disorders in which the deterioration of complex brain functions, such as memory or language, is evident. The association of old age with neurodegenerative diseases, such as dementia, was established as far back as the Roman Empire. But it was not until 1901 that a German psychiatrist named Alois Alzheimer identified and described the first case of the disease that would later receive his name. Dr. Alzheimer commented in his notes the case of a 51-year-old patient named Auguste, a woman who, according to him, did not understand the world around her, presented memory problems, hallucinations, disorientation, paranoia, and difficulty in communicating. These symptoms were associated with the deterioration of various areas of the cerebral cortex and the brain. The diagnosis of Alzheimer's disease is fraught with a strong family and social component. This condition affects millions of families around the world, increasing public health costs in many countries. This disease, considered irreversible, greatly impacts the public health system because of how long it lasts, the lack of curative treatment, and the burden it implies on the family. The person diagnosed with Alzheimer's disease is characterized mainly by clinical manifestations such as memory loss, aphasia, impaired coordination and motor functions, confusion, disorientation, anxiety, paranoia, and hallucinations. The presence and persistence of these signs and symptoms represent a risk to the sufferer's life and environment, since these patients are frequently involved in major accidents, many with potentially fatal consequences. Another aspect that is affected is the burden on the family. During the evolutionary phase of the disease, the patient progressively loses functions that allow them autonomy, such as the ability to make their own decisions or severe personality disorders. The rapid progress in medical research to determine the therapeutic properties of cannabis derivatives and their medicinal use brings.
Sample complete. Ready to continue?